I'm going to list a few things right now, and I want you to think about whether you've experienced any of them. Have you ever gotten a flat tire? Have you ever experienced a flight delay during a peak travel season? Do you ever get tension headaches? All of those events statistically have a roughly 70% chance of happening to you. What else has, at lowest, a 70% chance of happening to you if you have a uterus? Fibroids. 70% is actually the low end of the estimated percentage of people with uteruses that will develop fibroids at some point during their menstruating years. So at least 70% of you better listen closely to this episode, because statistically you are going to need this information at some point.
What's happening to your body, we don't know, because we've never really studied the female. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because you've never really studied the female body.
Welcome back to Cramped, the podcast where I try to find answers to my and other people's questions about their period pain. I'm your host, Kate Helen Downey. While you're here, if you have not already done so, I would just love it if you would go to patreon.com/cramped and join the Patreon at a paid tier. For just $5 a month, which is cheaper than any drink you can get at any happy hour that I know of, you will be supporting this project and making it possible for it to continue. Plus, we have great perks like a live Zoom chat once a month, voting on episode topics, and at $25 a month, you can even personally assign me a research question. So if you're getting useful information out of Cramped, if this show has helped you advocate for yourself in medical situations or informed you of options you never even knew you had for your period pain treatment, go to patreon.com/cramped. Today, I'm sitting down with two people who have helped tens of thousands of people with fibroids, and they're about to help even more. Fibroids, so far, has not been on the list of conditions that I am personally experiencing, but I'm eyeing that 70% statistic and taking note. If fibroids are on your radar, these are two people that you absolutely should be following and getting information from. I'll let them introduce themselves.
I'm Tanika Gray Valbrun. I am the founder of the White Dress Project. We are a patient advocacy organization that is dedicated to raising awareness of uterine fibroids. We've been in existence 12 years now. I can't even believe it. And we really are committed to making sure that people don't have to live and deal with fibroids alone. We really want them to feel like they have community and that they can come to our community for support and answers.
I am Dr. Soyini Hawkins, and I am a minimally invasive gynecological surgeon, which all that means is that I perform surgery through the tiniest incisions possible, or no incision if at all possible, to enhance the recovery process for patients. And it also means that I end up taking care of the most complex gynecological conditions, fibroid being one of them, and being one of them that I'm extremely passionate about. So I founded the Fibroid and Pelvic Wellness Center of Georgia. We have been in existence now almost 12 years. We are dedicated to meeting patients where they are and being intentional about their gynecological and surgical care and giving women all of their options.
That's huge. So you guys wrote a book together. You have a book that's coming out this summer. And we at Cramped are no strangers to the combination of advocacy and medical expertise and getting people all their options. But I would love to hear how this particular team up started of this advocate pairing with a surgeon to write a book.
So I'll start with that because I courted her. She was my dream girl. So
this is so romantic. I love it.
Oh my gosh. It's like the biggest love story. Dr. Hawkins and I met many years ago, and she often tells the story that she was enamored by my work and what I had started with the White Dress Project. And what I love about Dr. Hawkins is not only is she a physician and a surgeon and the leading surgeon. When we met each other, it was really a love at first sight. We realized that we had cultural similarities. We're from the same country, and we lived in the same place. She was so passionate about uterine fibroids, and I was passionate about making sure that we built community. So fast forward a couple years after that, and she became my doctor.
Wow.
And I had a myomectomy before she became my doctor. That was just not the best experience for me. My situation was really dire, and it was just a traumatic time for me.
Yeah.
And she became my surgeon. She shared candidly with me about her own fibroid journey. She shared with me why she was passionate about making sure that patients had good care and that they had options. And I said to myself, I feel so fortunate to have a physician and a friend who was really committed to the outcomes that I wanted. So I'll wrap this story up by saying that I was in a very precarious situation. She's done my last two myomectomies, Dr. Hawkins has done them. And the first one that she did, I remember going into the operating room and you have to do all this paperwork. And I remember saying to her, if you remove my uterus, we're going to have a problem because I want to be a mother so badly. And I remember her looking at me and saying, I will not do anything to harm your chances of becoming a mother. And I think for a doctor to say that, friend or no friend, I think for a doctor to say that kind of puts them in a precarious situation, right? Because, honey, you've already signed the paperwork. My liability is off of me. But she so cared. She was so committed. She was invested in my story. She made sure that's what happened, right? She knew that she was not going to violate what I wanted.
That's so huge.
So I say all that to say that when this book opportunity came to me, I couldn't think of anyone else that if we were going to broach the subject of how patients and doctors need to converse and need to build relationships so that we have the best outcome for each other, I wanted that for so many of the people that talk about they don't have that and talk about the dismissal that they've received from their doctor, talk about when their doctor didn't listen to them. So for me, it is the ultimate love story because a doctor and a patient can bridge their expertise and write something that people can use to navigate those conversations with your physician and also with your patient.
That's huge. Does the book have a title yet?
Oh, yes.
What
We're
is
so
it?
excited about it. It's From Fibroids to Freedom, From Silence to Strength. You feel so cramped, no pun intended, when you have fibroids and when you have reproductive health issues that you feel like you can't control, right? So we talk about how you get to that place of freedom. Dr. Hawkins in the book talks a lot about the clinical aspect. And I just share my story and also talk about how I held on to hope to get to freedom.
I love that. I have never thought of the metaphorical romance between a patient who has this pain and this condition and a doctor who's actually going to help them and get them to the result that they want, where there's trust there, right? There has to be trust. And that feels harder to find than a romantic partner sometimes.
That part.
Yeah.
Oh, that is so true. That is so true.
I want to get into the nitty gritty of the fibroids of it all. So I think we're going to turn to Dr. Hawkins for a rapid fire 101 on fibroids. So Dr. Hawkins, what are fibroids?
Sure. So fibroids in their most basic definition are tumors of the uterus. They're tumors and growths that come from the cells that we are all born with when we're born female, right? So the uterus itself has smooth muscle. The fibroids grow over time. They usually will start growing because they get sensitized by hormones. So we don't really see fibroids in really young patients. A lot of times don't even see fibroids in teens, though we have seen it, right? And we talk about that all the time when we hear patient stories and journeys, but they usually will grow over time because of hormone. Where they grow, the location of those fibroids usually will speak to the symptoms that a lot of women will suffer from or not suffer from. Fibroids affect 70% of all women 80 to 90% of Black women, and maybe 60% of them are actually symptomatic. So not everybody with fibroids has problems per se. Or some of that is hidden in a woman not understanding what's normal and abnormal, and maybe having problems, but not realizing fibroids have anything to do with it, right?
Before we go on, can we just underline those stats again? Because I'm sure they're very normalized for you. But what's the percentage of women in general and then Black women that are going to get them?
Yeah, 70%. So I tell people, look in the room. Right? 7 out of 10 of these people standing in the room have fibroids. And for Black women, it's the great majority of us. It's hard to have a conversation and bring up fibroids and not everybody's raising their hand saying me too.
Yeah, I know I didn't even hear the words fibroids until maybe 5 years ago. And I am a person actively living with severe period pain, and my doctors were not bringing that up to me. And then when I did hear about them, I was told, like, you probably don't have them. That's mostly Black women that are at risk for them. So that's infuriating on so many levels. Because none of that seems to be true.
That is correct. And I tell patients that all the time, and even communities I speak with and talks that I do, fibroid sees no color. Yeah. Yes, it disproportionately affects Black women, but I have a lot of Asian patients, and they grow some of the largest fibroids that we see out here. Right. So it is a complex that the majority of women are going to experience at some point in their life. Some might not find it until they're pregnant and they see it on the pregnancy ultrasound, and it's not necessarily even problematic, or they grow very large in their pregnancy and become problematic. So they can be tricky. They're disrespectful. It's my biggest word for fibroids.
I agree with that. Most things that cause severe period pain seem extremely disrespectful.
Correct.
And make me really angry.
Correct.
What are some of the signs that we should look out for fibroids? What are the symptoms?
So the most common symptom for fibroids is heavy menstrual bleeding. It's the one everybody knows about. Changing your pads frequently every hour or two, or your cups every 2 or 3 hours, where they should last for 12. Yeah. And some women have pain, but not everyone has pain. Fibroids don't always cause pain. And then a lot of women will have bulk symptoms. Some don't even have heavy cycles, but they go to the bathroom quite often, both with urination and bowel movements, or they have pain and discomfort with intimacy. And I also like to always highlight fertility. No, fibroids will not always cause a problem with fertility, but sometimes infertility is a silent symptom of fibroids that are not paired well together, or even, like you said, evaluated by physicians when patients have that complaint or concern. Yeah. So it can be vast.
Yeah. Tanika, does this line up with the symptoms that you had when you had fibroids?
Yes, absolutely. I was just going to say that was one of my silent symptoms. I battled infertility for 10 years. It's the common, like, okay, we're having sex, why aren't we getting pregnant? And you do all the other things like the tracking and the ovulation kits and all of those things, and it's not working. And it becomes extremely disheartening because oftentimes, to Dr. Hawkins' point, it's not coupled together, or the connection is not made. Yeah. So yeah, fibroids took so much of my time. Yeah. And to the point where I thought that I wouldn't be a mom. I had 3 myomectomies, which is the surgical removal of fibroids. My very first myomectomy, I had 27 fibroids removed.
Oh my God.
And then the second time, I think it was around 15 that she had to remove. Brain fog is another one of those silent things. Yeah. So there are the physical things that you can see, like the heavy period, like the pain, but there are also those things that you can't see that take you a really long time, a lot of times, to figure out. And then what happens is that so much time has gone by. I feel like fibroids robbed me of so much time, not only on the journey to motherhood, but just like youthfulness. I always talk about how I'm such a feminine, girly girl, hence the name of my organization. But thinking how many times I've said I couldn't go to something, how many times it has sacrificed my quality of life in doing something that would have brought me joy, or being social in college. So I just think about life. Now I have lived life, I will say that. But you do tend to think, how many more YOLO moments would I have had if I didn't feel like I was worried about bleeding out somewhere? Yeah. So yeah, I'm really glad that Dr. Hawkins brought that up, because that was absolutely my condition. the silent symptom that we don't want to think is being connected to these benign tumors, but definitely is.
Yeah. And Dr. Hawkins, is it like typical to have fibroids grow back that often and that many?
So let's talk stats again.
Yeah.
The statistics, depending on the source that you read, fibroid recurrence can be anywhere from 30 to 60%, even within 3 years of intervention.
Wow.
So even doing a major surgery with me or shrinking them and attacking certain ones, fibroids can recur as new tissue, as new tumors, even within a short period of time. And that's, we start talking about lifestyle modifications and doing all the things that you possibly can do. But unfortunately, our biggest risk factor for fibroids is just being a woman of reproductive age.
Yeah. Wild. Okay, so how are fibroids diagnosed in the first place?
Ultrasound. Super easy. Okay, let me actually back up. Physical exam and listening to the patient, pairing the patient's story, the patient's journey, being the detective that we as clinicians should be, and saying, something sounds a little off. I've been seeing you every year. Something sounds different about you. And then your exam feels different. Maybe your labs are shifting just a bit. And then simply getting an ultrasound, which is a step that I think delays the diagnosis for so many women because it's skipped. It's like, here goes your birth control to help with your pain or your heavy bleeding, but nobody even did an ultrasound because sometimes you can't feel it. I have patients that'll see me. I do a lot of second, third, fifth opinions, and some of the patients say, how did she not feel it? And I'll do the exam and say that fibroid was growing back into your pelvis or back into your tailbone. And yeah, she probably didn't feel it, but if she would have done an ultrasound, she would have seen it.
Yeah, that's so frustrating. So
it is.
Once you identify, yep, these are fibroids, you have fibroids, what are the different treatment options that are available?
Treatment options are vast. A lot of people think treatment options are either hysterectomy or bust or myomectomy or bust, but there are a lot of great technologies. It's 2026. Sometimes I have patients that walk in the room and they're like, my doctor said she's going to cut me up. And I was like, it's 2026. We ain't doing that. There has to be a better option out there. And it has to be paired with the goals. Like Tanika said, when she first came to me and she said, this is where I am. I know this is what my anatomy shows, but this is my desire. I need to meet her there. Yeah. It's not about what Dr. Hawkins thinks is ultimately the best thing to do, given her age and her egg quality. We get those conversations in there a lot. And I'm sure I can say this, but I'm a woman of faith. So a lot of times I think my job is just to make room for God to work, right? Yeah. And that means that I'm pairing options. May it be us talking about shrinking fibroids, and there's uterine fibroid embolization and radiofrequency ablation that I do that I can even do through the cervix without any incisions, which is amazing and the newest technology for treating fibroids, all the way to myomectomy, which I can do in incisions that are this big, or no incisions at all, which is the way I did Tanika's very first surgery. No incisions at all. Or if they're large, I have to make an incision. All the way to people who want definitive options like a hysterectomy. But I just named 6.
Yeah.
It's not just 1 or 2.
Can you, just because these are options I haven't heard about before, and I feel like I'm not specifically deep in the fibroid stuff, but I'm deep in options for lots of stuff for period pain, and I have never heard of, what did you call it, radioembolization?
Radiofrequency ablation.
What is that?
That is the newest technology, and it essentially is shrinking fibroids using heat, using radiofrequency heat. So radiofrequency has been a technology that's been around in medicine for centuries, right? They've been using it on prostates and liver. Men had it way before we did, right? Yeah, and now we've just figured out a way. We just figured out a way to bring it into women's health, but it's not new.
Yeah.
But it uses that heat to actually kill the cells of the fibroid, and then they shrink over time and actually soften. Like we were talking about frequency of urination, pain with intercourse, back pain, things like that. It actually softens the fibroid as it shrinks as well. So I love it. Absolutely love it.
Yeah, that sounds like it could be a really good option for people.
Yeah, and it's done with 2 incisions, 2 little baby incisions.
Can I just add to that, Kate, that from the patient perspective, not everyone has the time to maybe go to fellowship and do these additional trainings, right? But if your doctor is not speaking in that way, hey, I may not have the expertise, but I just read literature on something new. So here's why you need to go to my colleague. or I'm not comfortable with that procedure yet, so here's why I want you to have a second opinion. A lot of times what we hear in our community is that my doctor didn't even tell me.
Yeah.
They just made me feel like this was the only option. And granted, doctors could be right that a hysterectomy might be the best thing for you. But if that is not what you want your outcome to be, as a patient advocate, as someone who is the CEO of their body, you have the right to have all those conversations. Once you get all that laid out, if that is still the outcome, then so be it. But I don't like the fact that so many women are being rushed into skipping the process, essentially, because their doctor doesn't have the expertise, isn't familiar with the procedure. Dr. Hawkins just mentioned that this is the newest technology. And a lot of times, and this is not to be disrespectful to the industry, but many times seasoned physicians sometimes don't necessarily want to embrace new technologies, right?
Yeah.
Dr. Hawkins just talked about a new procedure for heat. There is some new technologies now around using a form of cryotherapy to treat heavy menstrual bleeding, which can ultimately help fibroid symptoms. The industry is always evolving and changing. And I think anyone who's going to be your doctor, especially treating any reproductive health issue, needs to be on the cutting edge of what's happening, which makes Dr. Hawkins a perfect example of a stellar and model physician, because a lot of times doctors don't even feel like they need to be conversing this way with their patients, right? Because I'm the doctor, I know you didn't go to medical school.
Right.
Rightly, but you haven't been here all these years with my body.
Exactly.
I think patients need to boss up in that way and not challenge doctors, not be disrespectful, but allow this conversation of we're in this together to really forge this path to, I'm going to help you get what you want while maintaining my medical license. And if those two ever come to conflict, maybe I'm not the doctor for you, right?
I love that phrase you use, the CEO of my body. That crystallizes so much, a way that I feel like I had to grow when I finally got my endometriosis diagnosis. Was I was like, oh, I've just been taking what the doctor says when they say everything's normal, nothing's wrong with you. I've just been believing them instead of believing my body and what I know to be true, which is something's very wrong. And we've been told from when we were kids that the doctor knows best and we have to do what the doctor says. And there is a part of that where it's like we should defer to experts sometimes, but there has to be trust there. They have to have earned our trust. They have to deserve our trust. And doctors are just people. Lots of people don't deserve our trust or our faith or autonomy over our bodies. And lots of doctors don't either. And so we have to, as annoying as it is, we have to do the work to get that information so that we can make the best decisions for our bodies and know when we are in a situation that we should get out of, or a situation where someone is not giving us the options that we know exist. And it's annoying to have to do that work. Like, that should be somebody else's job. But we're the CEO and we have to do it.
We're the CEO and we have to do it. And the other way that I look at it is, I'm the CEO, but my doctors are on my board.
Yeah.
You know what I mean?
Yeah.
And it's that phrase that my mom used to say, if you're the smartest friend in the group, you need to find a new group. So I don't want to be the smartest one, right?
Right.
But I am the smartest one when I know the pain to the right of my belly button doesn't feel right. Yeah. And then when I say that, then you can say, oh, that's probably your right ovary connected to your bladder. That probably shouldn't be like that. So it's this mindset that we have to get to of marrying those two.
Yeah.
Those two.
We have a term for that now.
What is it?
If I can give you ladies any hope, right? There's the medicine world hears you, and the medicine world is shifting and starting to change. We literally have now panels and whole conference discussions about this thing called shared decision making, right? Do you remember in medicine for a long time, gaslighting was the buzzword? It is what we were pushing against and really advocating for patients around in the way that they communicated with their doctor and not letting their doctors get over on them, right? now as doctors, we are embracing this idea of shared decision making. It is the new buzzword. You deserve it as a patient. If you're not getting that from your doctor, like Tanika said, get a second opinion. There's nothing wrong with a third, fourth, and fifth if you need it. And hopefully you're learning something along that journey for yourself, doing your own research. I have a lot of, they come in with ChatGPT, honey, already printed out with all the things. And I don't, as a specialist, I don't mind it because I want to partner with them and getting an understanding of how their body pairs with what they think might be an option for them and the pros and cons of it. But shared decision making really is a great solution now to not having to figure it out on your own, but at the same time not being told what you just have to do.
Yeah, I think that's so important. We're going to take a quick break and we'll be right back. This might be a good time to mention that if you join the Patreon, you can listen to ad-free episodes. Just saying.
Cause we never really started the female body.
Welcome back to Cramped. Let's get back into the conversation with Dr. Soyini Hawkins. Okay, I have a couple more technical questions about fibroids. So, Dr. Hawkins, is it possible to have fibroids and endometriosis, or fibroids and PMOS, or fibroids and adenomyosis?
They are not mutually exclusive, my friend. And the reality is most women do. So about 40% of fibroids patients also have endometriosis. So by default, I am an endometriosis excision surgeon. I'm a specialist. I do stage 4 endometriosis surgery as well, right? I feel like the population of women that I take care of for their fibroids deserves that. It's crazy. It's ludicrous to me to think that some women go in for a fibroid surgery, their surgeon sees endometriosis and takes a picture and leaves it there.
Yeah, did you have to get further, I assume you had to get further fellowship training for that. And
I did.
Is there a reason? Why do you think more surgeons don't do that?
Because it can be intimidating. Endometriosis and adenomyosis, if you thought fibroids were scary, those are equally as scary complexities of the female anatomy. And from a surgical standpoint, endometriosis can be anatomically as complex as cancer. Right? So it can be intimidating. And then there are a lot of even endometriosis specialists the other way around. I get a lot of referral from some of the biggest and baddest endometriosis specialists in Atlanta because their patients have large fibroids, and those are intimidating for them. So this world and this idea that they're mutually exclusive, they're not. The majority of patients with fibroids have some endometriosis and adenomyosis as well. That's a hard one. You're shaking your head because I think you're familiar with it or have had these conversations around adeno before.
Yeah, just that my understanding of adeno is that there's not a lot you can do short of hysterectomy for adeno because it's inside the muscle of the uterus, and so you can't go in there and cut it out.
You can't go scoop every hole in a sponge out. That's how I describe adeno. But there are medication options. There are lifestyle modification options, anti-inflammatory options. And again, some doctors won't even talk about that. They won't even tell you about your diet and your exercise and your fiber intake and pairing that with a little Pilates and yoga and stretching and mindfulness. All of those, they're a part of us naturally as women, things that make us feel good. And when we have these health concerns and diagnosis, we can't forget about that living part too.
Considering how common fibroids are and how easy potentially it could be to get diagnosed, just a physical exam or an ultrasound, why do you think so many people walk around with undiagnosed fibroids and untreated fibroids so often?
Yeah, it's two parts to that. And I think Tanika can help answer this question, but it's two parts to that in my opinion. One is not a great understanding of what's normal and not normal and normalizing discomfort, pain, and suffering, right? But I also think it's another part of it that has more to do with the experience that patients have in the healthcare industry, like with their physicians, with their providers, what they've been offered. It doesn't mend and mesh with their lifestyle or their goals. They don't want 6 weeks of downtime. They don't want a large incision. They want to be cute on the beach. You know what I mean? And the fibroids have already, to Tanika's point, robbed them of so much of their quality of life. They just can't comprehend. Tanika and I had the same surgery. That surgery was hard. Open myomectomies are hard to recover from. It is the reason I became a minimally invasive surgery, because those 2 weeks where I couldn't walk standing up straight, I was like, there has to be a better way to do this for women. And so some women are running from those options. They're running from what's been told are the only things they can do because they just can't comprehend that kind of additional suffering in their life.
Yeah. As someone who ran from an endometriosis diagnosis for a long time, it felt too expensive and big and unfathomable. I get that.
Yeah, you definitely run from it, and you definitely trick yourself into thinking that you can manage it, right? If it's just not wearing any white clothing, okay, so be it. If it's taking 800 milligram ibuprofen an hour before I know my period's going to come, so be it. If it's not going to the party, so be it. If it's calling out sick from work, so be it. So you not only normalize what we think periods and fibroids symptoms are supposed to be, we normalize the quality of life part too. I didn't want to go to the party anyway. Yeah. Oh, but I did though.
Or we even like gaslight ourselves where we're like,
oh, absolutely.
Oh, it wasn't that bad last month. I'm fine.
Exactly. Exactly. So I remember thinking to myself, who doesn't change their pad every hour? It's just, I'm just a woman. That's what it is. Yeah. And I think even culturally, there's a lot to be said about how we teach our young girls about what is normal. I love ACOG's new mandate on what is normal. And it's like, if it's messing with you and your life, then no, speak up. Yeah.
A period should not be an event.
Yeah.
Right. It should not be a pause in your life. Mm-hmm. If it's doing that, something ain't right. Mm-hmm. Simple as that. Mm-hmm. Simple as that. The anatomy of a uterus, it cramps when you're bleeding. So you might need a 200 milligram Advil, but you shouldn't be doubled over with the heating pad and calling out from work. It shouldn't be an event. You should be able to continue to enjoy life during that time period. And if you don't, something's not right, period.
Yeah. I think this is why we need to be thinking about how we can have these conversations earlier, because we all know that girl in high school, once a month, 3 or 4 days, she was like, I was going to say she's paging everybody. So I just completely dated myself. But here
yes,
we are.
you did.
I know, right? You can edit that out and say text everybody.
Leaving that in.
She would page everybody and be like, not going to make it to school today, or the beeper codes or whatever it was.
Yeah.
But yeah, so we all know that girl in high school and really that girl in middle school too. So we really need to be having these conversations. And what became of that was, oh, it's just my period. I'll be fine. But I'm doubled over today.
Yeah.
And to Dr. Hawkins' point, nobody should be in fetal position over their period.
Yeah. And I did an episode because I was so curious about, wow, has period education changed like in middle schools and high schools since I went to school? And no, it has not. And there is basically no education. There's minimal education about periods themselves other than like, they're going to happen. You better wear a pad. Don't tell anybody. When like school is where people are going to be when they get cramps. That's where I was when I was doubled over and throwing up. The nurses are going to have to, and I love the work. There are some school nurses who are getting trained to be able to recognize the symptoms of endometriosis and then to have conversations with parents saying, hey, here's a pediatric gynecologist I recommend. Your daughter may be experiencing endometriosis and we can catch it now. We can manage it. And just that this needs to be well known in the places where these people are experiencing it for the first time. And it's really scary. And that this message of, hey, that's not normal. That's like, let's get you help. Let's figure out what's going on. Like, that's not just something we're going to be like, you have bad periods, I guess.
And I'll add another layer to that. I think the family unit is important too. I think about, my cousin called me about her daughter and I was like, oh, sounds like she might have endo. But then I find out literally months later, she had a whole hysterectomy because of her endometriosis. So I'm like, so you didn't think that was happening with you could possibly be, you didn't see yourself in what your daughter was suffering with? I was blown away that she missed that opportunity. And she told me, I'm sure after a long time of her daughter suffering for months and months, but it never clicked for her.
But I think that's part of the culture of silence around it. We push it to the back of our brains. We just are told, forget it, don't think about it, don't talk about it. And so, of course, it doesn't come up when it's like, oh, a whole new problem when my daughter's having it. Yeah.
It was crazy. But we have to keep having these conversations.
Yes.
The intergenerational conversation is so important. We hear so many people talk about how their mom was like, honey, you're going to be fine. I had this surgery when I was your age being rolled into the operating room. And it's like, Mom, why didn't you tell me before?
Tell me.
Yeah.
And we have a thing I'm just going to speak from in the Black community where it's like grandma and auntie had the surgery. And now we're all learning that the surgery was a hysterectomy, right?
Yeah.
For many times for fibroids.
Yeah.
So this idea that we're just teaching people how to manage these symptoms. My mom taught me how to take the Advil before the pain got bad.
Yeah.
But we never addressed, why is the pain so bad?
Yeah.
Why did you have multiple miscarriages before you had me?
Yeah.
Because of what? It's just this silent thing that we feel like somehow we're not ladylike or classy if we're sharing this information, and it's really done our generation a disservice.
Yeah, 100%. So we talked about that fibroids grow because they're stimulated by hormones, but then we don't really know how to stop that from happening. Is that right?
Correct. We don't know how to limit it happening naturally in our body. It's one of the most common questions I'll get, especially after surgery. Sometimes before, but especially after surgery, is how can I not have to do this again? So I do talk to a lot of my patients about limiting their intake of additional hormones, or what we call exogenous hormones. You may not be able to completely downregulate, and you kind of don't want to, right? Because estrogen is our claim to fame. It is what gives us our curves. It's what allows us to be able to carry pregnancies and makes us feminine, and libido and all of those things are attached to it. So we don't necessarily want to shut it off. However, adding to that, like with preservatives and a lot of fast foods and research has shown even red meat and products that have a lot of hormones placed into it, but also naturally in it. So even if you're getting organically fed bison, you're still getting a good healthy dose of hormones. That impacts fibroids. Stress impacts fibroids and the way they grow. I saw some of the biggest growth in fibroids and the worst symptom involvement during COVID.
Yeah, I'm sure.
When the world had to press pause. Yeah. And then also vitamin D deficiency, especially for melanated women. So brown women, period, our melanin blocks the sun, so we don't get as much vitamin D. And vitamin D is important from head to toe, but specifically with fibroids, that vitamin D being insufficient actually exponentially allows fibroids to grow and become more symptomatic. So supplementation with that, and research also shows green tea extract as a supplement, like a pill supplement, can help to decrease some of that growth of fibroids over time. So can change internally, but we can certainly help with being very selective about what we're adding. Even on our skin, lotions and things in our hair make a difference too.
Yeah, that's always so overwhelming to start to try to think about avoiding those things in our, because I was like, my laundry detergent has these things in them.
My water bottle, girl.
I know. It's impossible
water
to do
bottle.
it perfectly, but
Exactly.
Yeah, trying to figure out the right amount that's going to be not overwhelming, but make a meaningful difference.
Absolutely.
Do you feel like there is going to be like a cure for fibroids at some point?
I love that you asked this question. I do. So the big picture, right? Fibroids are something that for all intents and purposes, is somewhat innate to our bodies. They grow from our natural, healthy tissue. So don't get me wrong. You could do everything right. And fibroids can still grow. So I don't think there's an opportunity for us to eliminate them completely. However, the reason that I am a minimally invasive surgeon, I want to stay ahead of the technology and know what's there and what's coming and what the research shows, is because my hope is that one day we can treat fibroids like a preventable disease, or we can intervene sooner before they become distressing for women. So we're treating fibroids that are smaller, like that shrinkage procedure I talked about earlier, before they wreak havoc and become debilitating.
Yeah.
And so that might be as close as we get to a cure, is treating just like we would diabetes, hypertension, all of those things. The earlier you get diagnosed, one, and the earlier we can intervene, the more not only options you have, but better options you have. And you can probably head it off before it becomes devastating.
Yeah.
So maybe not cure, but I do think that we can get to the point where we're getting patients taken care of a lot sooner.
I love that. Before we sign off, Dr. Hawkins, is there anything else that you want to share and make sure that people know, whether that's myth busting something about fibroids that we haven't covered yet, if it's where people should go to get more information?
Just another plug for our book. We have these conversations in our book. Tanika speaks to the real world experience that she's had. She's actually very open. I'm so proud of her. I mean, I cried reading some parts of the book because I know her story and her journey, and just for her to put that on paper to share with other women that may be able to empathize with her and see themselves in her journey. And then I think the openness and that combination of the patient's real world story, but also let me give you some tools, right? Some real background understanding of what your body is doing, because that is always my goal in the consultation room. I hope that patients choose themselves. That's what I call it when my patients decide to have surgery. I'm like, I'm so proud of you. You chose yourself today. But more important than them choosing to have any procedure with me is them understanding what's going on with their body and understanding what their options are, right? Take that home, pray about it, and then come back with some questions. You don't have to decide today. That's how it should end. Yeah. So this book is going to help with that. We're talking about the financial burden of having fibroids. We're talking about how do you talk to your loved ones about your journey with fibroids. We're talking about your support system helping you. How can they be an ally in this journey that you're going through? We're covering all of those things in our book because we thought it was important to breathe into the women and the husbands and the girlfriends and everybody that would be reading this to support a pandemic amount of women that are suffering.
All around everyone. Yeah, I love that. Yeah. And Tanika, can you say the name of the book one more time?
From Fibroids to Freedom, From Silence to Strength.
This episode will come out in August, so I'll make sure to put the link in the show notes. So go click on the link in the show notes, buy this book. And Tanika, can you also talk a little bit about what White Dress Project is and what people can find there?
Yeah, so the White Dress Project is my other baby. And it really was birthed from this place of just feeling like I was alone, that I was going through all of these symptoms, felt like I had some knowledge of them because my mom went through this, but still feeling very alone, very silenced, very dismissed. And after my first myomectomy, where I had 27 fibroids removed, I felt like I could not be the only one who is managing life with fibroids. And I just wanted people to feel community. I wanted them to feel not alone. And I also wanted people to understand and make the connection between fibroid symptoms and the impact on quality of life. So that's where the white dress comes from. I just never felt comfortable wearing any white clothing. I never felt comfortable with light colored seats or light sheets on my bed or light towels. So the White Dress Project is really that community that understands all of that. Last year, we started working with Lupita Nyong'o, the Academy Award-winning actress. She is such a gracious patient advocate as well. Obviously, she has celebrity, but she is also a patient who wants answers, who doesn't understand why the treatment options were so limited to her, right? So it's really that community. It's really encouraging people to share their stories that really brings all of this together for me. I'm a journalist by trade. And so I understand from a very young age the power of our stories to influence silence, to move the data, to challenge norms, to challenge political entities and strategies. Like, it all starts with our stories, and stories resonate with people. So that's what we do at the White Dress Project. We have events across the country and internationally that really bring women together. And you know that when you come to one of our events, that everybody in the room gets it. And there's something very powerful when you're in a room and everybody gets it.
Yeah. That's amazing. Thank you both so much for coming on and sharing your time and expertise with us. I appreciate it so much. And as always, it's so nice to just share stories with two people who have been there and get it.
Thank you. We appreciate you.
Thank you, Kate, so much.
That's it for Cramped this week. Click into the show notes to find a link to Tanika and Soyini's book. I will also put a link to the White Dress Project in there and a link to Dr. Hawkins' website, where you can find information on her practice located outside of Atlanta. And while you're in those show notes, click on over to the Cramped Patreon and support this work. This episode took roughly 20 hours for me to make from beginning to end, and it's just me over here trying to make this my full-time paying job. So if these episodes are worth $5, $10, or $25 a month to you, it would genuinely make a huge difference. See you next time, Crampers.
What's happening to your body? We don't know, because we've never really studied the female body.